Hello, this is Roseann Vitale, and I am going to be reviewing how to do a prosection of a kidney specimen. What we have here is a pig kidney, which I have previously inked for your orientation purposes. When receiving a kidney specimen, make sure that you weigh the specimen in grams, measure the kidney overall in 3 dimensions, and measure the hilar structures in length and diameter. In order to orient a kidney, you utilize the hilar structures. The renal vein is the most anterior vessel that is present, and I have inked that here, which I'm opening right now with my forceps. The renal artery is posterior and superior to the renal vein, and the most posterior and caudally coursing vessel is the ureter, or structure. And that's what's present here and is inked blue. All of these structures can be inked the same color since they look different under the microscope. I have additionally created an inked area on the superior aspect of the specimen. And this is something that you would do after you palpate where a lesion is within the kidney. Remember that you should always check your radiographic images and the clinical history of the patient in order to identify where you should expect to find the lesion. But then you need to do the secondary work at the bench of palpating the lesion yourself. So what I've done is I've created a inked area in the superior aspect to demonstrate where I would have quote-unquote palpated the lesion. Remember to examine the renal artery, renal vein, and ureter for presence of tumor before you shave these structures. I'm going to go ahead and shave my ureter. You can do this with scissors or with a scalpel. And those are submitted into the cassette en face. Here I'm using my scissors to shave that renal vein margin, taking the forceps and cutting. Okay. After you have bisected your kidney, you will want to observe the location of your lesion. In this case, I have created an orange-yellow ill-defined lesion with ink. After observing where the lesion is located, you will want to serially section the specimen. In this case, I have done a radial section in order to maintain relationships of the lesion to my renal sinus fat. Tumor invasion into renal sinus fat is associated with a poorer prognosis for the patient. You will want to measure the lesion in 3 dimensions, remembering that there is tumor on both halves of your kidney. As you can see, I have tumor here that extends in this orange ink past my initial cut. Additionally, on this half, I also have tumor here. So what I would need to do is make sure that I get the greatest dimension of all 3 axes in order to get my most accurate tumor measurement. I will need to then, after I take my 3 dimensions, measure the distance of the tumor to the outermost surface, in this case, the kidney capsule. So I can see the edge of my orange ink here, and it looks like it is only 0.5 centimeters from the kidney capsule. And of course, I would examine all of my slices to make sure I'm making the most accurate measurement there. Your tumor measurement could be from here to your distance to the outermost surface could include kidney capsule like it does in this case, or it could be perinephric fat or Gerota's fascia, which would be considered the true margin. Important sections to take include, as previously mentioned, tumor to renal sinus fat, tumor to outermost surface, in this case kidney capsule, and tumor to uninvolved. Renal cell carcinomas tend to be variegated in nature, meaning that they have a variegated appearance. They may be hemorrhagic, may have areas of necrosis, and may be friable. Oftentimes it is wise to, after serially sectioning a specimen in this manner, to place it in formalin and allow it to fix for a few hours at least in order to avoid contamination of your blade on various cut surfaces. I will go ahead and take a few sections to demonstrate how you would continue making your cuts here. But before I do that, I'd like to just talk about a few other measurements that you should take, which would include your cortex thickness. So that is this brown area here. So the average cortex thickness is about 1 centimeter. So I would state that looks like maybe 1.2 centimeters. And the description, you should include a description of your renal pelvis. In the human specimen, the renal pelvis is white tan, smooth and glistening, and the renal adipose tissue or renal sinus tissue is yellow tan and lobulated. So it will be much easier to identify where that is in the human specimen as opposed to the pig kidney. So I'm just going to go ahead and sample a few key sections. So as I mentioned here, I was stating that this was my closest tumor to kidney capsule section. So as you can see here, there's ink, there's my lesion, and there's the outer capsule. So that's one important section. So I'll make sure to put that in my cassette, and I would of course trim it as it's a little thick. I would take tumor to my renal pelvis, which you can see I have here. I want to demonstrate that white tan adipose tissue there. Okay. And then depending on the size of my lesion, I would of course take 1 per centimeter, and that would include the tumor to outer surface, which could be again capsule, perinephric fat, or Gerota's fascia, tumor to the renal pelvis and renal sinus fat. And let's get another one of tumor to uninvolved. Okay, tumor to cortex and medulla. So here you can see the medulla on the cut surface. Okay. All right, and now I need to make sure that I, of course, change my blade in a human specimen. I'm not going to do that right now, but I would change my blade because you don't want to contaminate normal tissue with tumor cells. So I would make sure to get uninvolved inferior pole. And that has cortex and medulla. Great. And uninvolved renal pelvis. Okay, and that is how you prosect a kidney. Remember the friable nature of renal cell carcinoma. Remember to allow your specimen to fix. And we'll discuss other questions in our laboratory session.